1-888-208-6946, the number to call for our family health experts. More specifically today, it's Dr. William Walden of Paducah Dental Care, and the topic is anything related to the teeth. Give us a call. He's got the answers. I do have a question from Bob in Fredonia, who says he's got a bump on his gum, and when he squeezes it, pus comes out. So the tooth bite does not hurt. Should he be concerned?
Well, if you've got pus coming out, that's telling you you've got some infection. If it just happens one time, and it goes away and doesn't come back, then, I think you may be okay. But it's kind of like a pressure relief valve. So if it didn't release that pus, then it would start blowing up. So the pus is coming from either the tooth or the gum. So if it continues to stay around or happens more often than once, I would have it checked out by your dentist. Good question.
Amy from Murray is viewing today and says her mother has worn dentures for 40 years, but is having trouble eating with those dentures. Would implants be a good alternative?
Well, 40 years with dentures is a long time, and during that 40 years, the bone in the mouth will start to shrink. And so even if you had a good set of dentures originally, many times then, they won't fit anymore. So I would, go to your dentist and have them check it out. Sometimes a reline of the denture can make it work. Sometimes a new denture. Sometimes if there's, if it's not going to work at all, then, if you got room for implants, that would definitely help. But I would get to the dentist and have them checked out. So, 40 years, that's much like a roof on your house, and it's time for something to be done.
Next question comes from south of the border down in Paris, Tennessee. Claire is watching and says she wants to know what she can do about her husband's bad breath. She's tried giving him mouthwash and some other alternatives, but nothing seems to help.
Well, nobody likes bad breath, and nobody wants to be around bad breath. Bad breath can come from foods we eat. Of course, if you said that mouth rinse isn't helping it, sometimes it can be from medical issues in the stomach. The mouth is kind of a special place in that it's wet and moist. It has bacteria, and you add a food source to it, then it's kind of like a wet garbage can. So that's where periodontal disease can creep in there, and so then it's kind of mushrooms. So I would definitely, have a checkup with the dentist and see if it's not from tooth decay or possibly periodontal disease, and see if they can get it cleaned up that way.
I have about 45 seconds left, and Tom here in Paducah wants to know if the over-the-counter teeth whitening products really work.
Well, I think that they can. I tell my patients that go ahead and try them, and sometimes they're a little hard to apply, but I've seen people get results with the over-the-counter. A lot of the ingredients are the same that you'd use in a dental office. So yeah, go ahead and check them out. I think they can work, and just be careful with them. And the gums can be very sensitive, and so if the material gets on your gum, then it can cause the gums to get sensitive or even slough a little bit. But go ahead and try it and see, and if not, check with your dental provider.
Dr. William Walden of Paducah Dental Care has been our guest on this portion of Family Health Experts. If you would like to review this segment, give us a little bit of time and we'll post it online under Family Health at WPSDLocal6.com.